Good morning and welcome back. As New York City becomes the first to offer the COVID-19 antiviral Paxlovid, there is growing concern over COVID rebound. With even Dr. Anthony Fauci reporting this despite its effectiveness, he had joined the ranks of those who had gotten COVID after taking that medication. Joining us to discuss is Chief Medical Advisor, Truth for Health Foundation, President, Cardiorenal Society of America, and author of The Courage to Face COVID-19, Dr. Peter McCullough. Doctor, good morning and welcome back.
Thank you.
All right, doctor, before we get into Paxlovid here, can you give a little bit more detail onto what this COVID rebound is?
It was actually described with the medication Paxlovid. And the idea here is the virus is replicating in the nasal passages and then down into the lungs when there's pulmonary involvement. And with this medication, which is a combination of a novel kinase-like 3 inhibitor called nirmatrelvir, plus an older protease inhibitor, ritonavir, which is used in HIV, that this inhibits viral replication, but the virus is actually still alive and replicating at a low level. So when the medicine is stopped after a few days, the syndrome comes back. And as described in our National Allergy and Immunology Branch Director, it actually is worse. And the CDC actually had to put an advisory out on this on May 24th, saying this could happen. And it was based on published papers by Gupta, Charnes, and Carlin, all describing this in the fully vaccinated.
Doctor, so the virus is still active, which we saw with Dr. Anthony Fauci. He took Paxlovid on the 4th day. He was testing negative. 4th day, he tested positive. But like you're saying, it's because it's still active, it sounds like. And then you mentioned it's worse. And if there's an advisory, it seems like this could be something that's a common occurrence, is it?
It appears to be. I've seen it in my clinical practice. Now, the EPIC-HR study, the large randomized trial of Paxlovid, the average age was 45 years old, and it was all in the unvaccinated. And the medication did reduce the risk of hospitalization and death, and no rebound was described. So there is a suspicion here that the vaccine is not allowing the body's immune system to orient towards the new forms of the virus, the Omicron variants, BA5 and BA4. And that there's a process called immune imprinting, that getting serial vaccines against the extinct Wuhan spike protein is throwing off the immune system, allowing this rebound to happen with Paxlovid.
Doctor, is this antiviral treatment worth it?
You know, we've had a community standard of care from the beginning. It started with hydroxychloroquine, plus other drugs in combination. We know the steroids, prednisone, aspirin, they play important roles. We never use a single drug alone. I think that's a big mistake to rely on Paxlovid alone. But, you know, I'm using it in my clinical practice and having good results in the unvaccinated. But the concern here is that with, you know, this example, it's someone in their 80s. They're fully vaccinated. There was no mention of other medications in the multi-drug protocol. It's been referred to as the McCullough Protocol. So he's far away from his community standard of care. You know, based initially on hydroxychloroquine, then ivermectin. We use Paxlovid, use molnupiravir. But the principles are multiple drugs and sequence combination, and for longer durations of time. You know, in my practice, somebody in the 80s, they can commonly need treatment for 30 days.
30 days is a long time. Doctor, the FDA is recommending COVID boosters for fall, which are updated for Omicron, saying the worst version of COVID is one of these variants. Do you think it's necessary for all subvariants?
You know, we'd have to look at that pretty carefully because the randomized trials have not shown success against Omicron. None of them have. And actually, the recent CDC meeting demonstrated vaccination against Omicron had nearly 0% vaccine efficacy. So without clinical trials demonstrating reductions in hospitalizations and deaths, it'd be my interpretation it's simply not worth it. We know the side effect rate, including injuries, disabilities, and deaths, is staggeringly high with this product line. Most Americans are staying away.
Doctor, it's interesting to hear what you're seeing when it comes to your studies on those who are not vaccinated when it comes to Paxlovid as well as booster shots. Before we let you go, though, I do want to touch on your book, The Courage to Face COVID-19. Can you let our viewers know what this is about?
I teamed up with true crime best-selling author John Leake, who had returned to the United States from Vienna. Took us a year to write it, but it's a narrative. It's a genre nonfiction true crime narrative. Describes the discovery of the treatment of COVID-19 in multiple places around the world. I played a role, but how did I become the doctor of focus called by the White House, by the Senate? How did things advance in such a way where doctors like myself were attempting to help patients get through the illness, and then we were met with suppression of early treatment, actually things that made it difficult to use the drugs. Fraudulent manuscripts published, statements were made, what's called crude propaganda against anything that could help patients in order to promote the vaccines. So it's a gripping narrative. It's a page turner. It's a story. It's not a medical book. It's a story, but it's nonfiction. I think it's worth the read. It takes about 2.5 hours to read it. It's a lot of fun.
Dr. Peter McCullough, thanks for joining us this morning, and we'll be looking forward to hearing how your studies continue to progress. Thanks for joining me.
Thank you.